Welcome back, everyone. As we move into the debrief, I want to remind you that we're all here to learn and really reinforce the importance of respectful and open communication. Remember that this is a place where you can ask questions, you can share your thoughts openly, and there might be moments where you feel like you're being pushed out of your comfort zone, and that's okay. So if you have it printed, that's fine. If you have it online and you want to access it, this would be the best time to do so. So I'll give you a minute to pull those out. As you do, I want to share that I will not be collecting the DML forms. This is for you to study from and refer back to in the future. Okay, so you can write things that you truly are feeling and want to put down on paper. Any questions? So complete the first 3 boxes of page 1. Take a few minutes to do that. When you're done, just look up is when I know that you're ready to start. Okay, everyone's ready? All right, can someone tell me about who our patient was today that we took care of?
The patient's name is Maria Ramirez. She's 50 years old. She's married. She has a daughter, and she lives close to the hospital.
Okay.
She has a history of hypertension, diabetes, and breast cancer.
A surgical history is mastectomy and hysterectomy.
All right, great. Can someone tell me why she was seen today?
She was having chest tightness and she felt woozy. Her symptoms started 4 hours ago, and her vital signs were off a little bit in triage.
So chest tightness and felt woozy. Okay. So Joshua, I heard you say that her vital signs were off a bit. Can anyone expand on that?
Sure. Her blood pressure was 160/100, which I thought was rather high, and her respiratory rate was 25, and her O2 sat was 92%, which I was also worried about.
All right, so I hear you saying, Maki, that you were worried about her O2 sat. Can you tell me a little bit more about what worried you?
Well, mainly her breathing. Her O2 saturation was rather low. She looked like she was having difficulty breathing and appeared to be in a lot of distress.
Great observations. What actions would you take as the nurse?
In this scenario, patients in the ED room waiting for providers without oxygen, I think I would have listened to her lung sounds, started her on continuous pulse ox monitoring, and start her on oxygen.
Okay, so assessment, pulse ox monitoring, and start O2. Okay, so can you tell me a little bit about why you would have started her on O2 and assessed her breath sounds prior to the physician seeing her?
As a nurse, I need to assess my patient to manage their care. According to the triage vital signs and the patient's appearance, there seemed to be a respiratory distress. That's why I think it's important to listen to the lung sounds and her pulse ox, because her pulse ox is 92% and she's gasping for air. I would rather start her on 2 liters of oxygen.
I agree, but as the primary nurse, I wanted to make sure that the patient had an interpreter so that she can understand what we were saying, and I wanted to get an accurate assessment of what was happening. So I decided to call the interpreter first.
Can you tell me why you asked for an interpreter for this patient?
I overheard her speaking in a different language to her daughter before I went into the room. And I looked over the demographic and I saw that her last name is Ramirez. In the past, the patient that I've taken care of that has the same last name always needed an interpreter. So I wanted to be efficient, so I called the interpreter to help provide a patient's.
Thank you for sharing that, Wumi. That's very interesting. So what I'm hearing is that your lived experience of caring for patients in the past has influenced how you provided care for Ms. Ramirez today. Is that correct?
Yes.
And we're very fortunate to have our standardized patient, Ms. Ramirez, with us. So I'm going to go get her. You guys hang on just for a minute. Okay. Thank you, Ms. Ramirez, for joining us today. So tell us, how did it feel to be a patient with our students caring for you?
Hello, everyone. Thank you for the care that you gave me. First of all, I would like to share with you something about myself. I am bilingual. I am fluent in Tagalog, the national language of the Philippines, and I am fluent in English as well. Well, in the ED, I was anxious, with the weight and all. when they called the interpreter, the staff called the interpreter before anybody even spoke to me, that made me anxious. When the staff and the nurse communicated with me in English, they started caring for me, then I was happy. So I was happy with the care that I received.
So does anybody have any questions, comments, or feedback for Ms. Ramirez?
I do. I am very sorry, Ms. Ramirez, that I assumed that you could not speak English. I made the assumption because of your last name.
All right, Ms. Ramirez, thank you so much for your feedback and joining us today. I really appreciate it. And now you're free to go. So we heard from Ms. Ramirez. How do you guys feel?
That was an aha moment for me. I just incorrectly assumed that Ms. Ramirez could not speak English.
This is sometimes how our brain works. Many times we are unaware of how we relate our assumptions and how it impacts the care or the actions that we take. Can anyone tell me what this is an example of?
I think this might be an example of implicit bias.
I remember watching a video about this in our pre-sim homework.
Yes, it's very important for us to understand what implicit bias is. And more importantly, what we as healthcare professionals can do to ensure that all of our patients receive the best care possible. Can someone share a little bit more about what implicit bias is?
Implicit bias is how sometimes unintentionally we just make assumptions about others, and it's completely unintended. We're not aware about it, and sometimes it can just make us have bad judgment calls.
Okay, so now, if you were in this scenario, how would you have handled this? How would you have provided care for this patient?
I think I should have assessed Ms. Ramirez first, and then I would have known if she could speak English or not.
Okay, so what I hear you saying, Wumi, is that you would have acknowledged and challenged your assumption that Mrs. Ramirez did not speak English before calling the interpreter. Is that correct?
Yes.
Okay, so we're starting to understand a little bit more about implicit bias in the healthcare environment and how it can impact patient care. Can someone tell me how it impacted the care of Ms. Ramirez today?
In this scenario, it looks like Ms. Ramirez's care was delayed because they were waiting for an interpreter.
I can see how this is a good example of what we read about in our pre-sim homework and how implicit bias can negatively affect patients' outcome.
Wonderful. I think we have all learned a lot today. Can you share one thing from today's experience? It could be in your pre-brief or the sim or the debrief that you are going to take away with you and possibly apply in future clinical scenarios.
I learned that it was important to take time to know your patients. This is something that I can apply in my future clinical experience.
I learned about what implicit bias is, and I think it's important because I'm going to be working with a lot of people, and I want to make sure that I'm going to give equitable healthcare.
To be honest, I didn't think I was biased. So this was a huge learning moment for me. I've learned to challenge my biases, and I'll take this to my future clinical experiences. I will make sure to check myself if I'm making assumptions, and I'll check if my assumptions are correct.
Great job. I think you have done a great job today. Thank you for your engagement and your level of participation. Thank you, everyone.